Good afternoon. I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, April 10th, and I'm here with Ed Brubaker, Living Branches President and CEO, to answer some more of your questions. Hi, Ed.
Hi, Alex.
So our first question is a question that I'm going to ask. I've heard you talk a little bit about what you consider to be an essential business, and I wonder if you'd like to share some musings on that with us.
Well, I know a few weeks ago when the essential business list came out from Governor Wolf, it was interesting to me that haircutting, barbers, beauticians were not on the list, I should say they were on the list to be a non-essential and need to be closed. But at that point in time, beer distributors were open. So it seemed a little odd as to the choices of what was essential and what was not essential. I think beer distributors eventually got on the non-essential list, but haircutting places and barbers are still on the non-essential list. So I'm not sure if a few weeks from now I'm going to be doing these with a ponytail or not, but I guess time will tell as to how long barbers and beauticians are considered to be non-essential.
I'm sure that we will all be enjoying that day when you're doing this with the ponytail. So our first question that we have today comes to us from Diane. And Diane's question is, she says, I just saw a doctor on CNN saying people should pick up their loved ones from nursing homes to keep them safe. I have a lot of confidence in Living Branches, and I think I wouldn't be able to give my mother better care. But I'm wondering what Mr. Brubaker thinks of this. Is this something that Living Branches would encourage?
Yes, Alex, that's a good question, and one that I've heard as well about whether someone should let their loved one in a nursing home or personal care facility during this time. And certainly that's an individual consideration, but our feedback would be that persons should stay where they're at. To move a person in that situation can be disconcerting to them. That is their home, that is where they live, and so that would be one reason. I know Mark Parkinson, who is the president of the American Healthcare Association and the National Center for Assisted Living, he actually commented on this recently, and I thought I might just read a quote from him. And he says, in the overwhelming number of cases, that would be a huge mistake to take your loved one out. They simply can't be, meaning the resident can't be isolated at home. They're in a safe environment in a long-term care facility if the equipment is there to take care of them. And in the vast majority of cases, bringing these folks into the personal and general population would be very dangerous right now. We are not exempt from the potential of COVID, and in fact, we'll talk later a little bit about that. But we also feel that to disrupt the life of a person, we also recognize that for many families, it would probably come as a surprise and maybe even a hardship as to the level of care that really is needed for their loved one. And so we have the staff and the professionals to be able to deal with that. And in many cases, the level of care would be very difficult to do at home. In addition, as you think about a home life, if there's children at home and persons in and out, there's just additional possibilities of bringing this disease into the home. Again, not to say that doesn't happen with us, but we just feel overall, in the vast majority of cases, that would not be to the advantage of the resident, and frankly, or the family.
Another question that I've heard from several people is how exactly will we know when we have a positive test? There's been a lot of controversy about testing in general, and do people have access to tests? So I've had several questions wondering, do we have access to coronavirus tests? And if not, how are people getting tested?
Yeah, and the quick answer to the piece of how will we know if they're positive, the only way you know they're positive is if a test is done. And so symptoms can point to that, but the only way you really know is if a test was done. I would say testing is becoming more available, but at the front end, when it was seeming like from some sectors of the government, they were saying that was quite available. That was not our experience. The challenge right now is the turnaround of the test time. I think in general, we can typically get tests if there's symptoms that would show that the test is required. But the getting the results back is the part that's more challenging, and that can take up to 4 and 5 days. We are finding some alternatives to that as well and are exploring doing that. Because as you can imagine, in those 4 or 5 days, there could be exposure, and we need to know that. And so testing is very important. And I believe that in the future, it'll become even more important because this thing is not going away tomorrow. Okay, this will be with us for some period of time. And from my perspective, the only way we can really get a handle on it is for us to be able to have more testing, more rapid testing, so we know if employees are at issue, if residents are at issue, and then we can address that as opposed to waiting for the end. So testing is very important. It is becoming more available. I am looking forward to the day where we don't have to beg for the tests or prove that the person have symptoms in order to get the test, but in order for us to be able to get the test so we can really see how we're doing and how we can segregate employees and residents during this process.
We learned this morning, of course, that we did have our first resident test positive for coronavirus. This is a resident who lives on our Dock Woods campus. And then literally just minutes ago, we found out that we also had an employee who works in personal care at Souderton Mennonite Homes test positive. So what do we need to know about this?
Yeah, and that is correct. We did have a resident at Dock Manor and also an employee at Souderton. The positive news, I know it's negative to hear that there's a positive test, but the positive news about those situations is that in the case of the resident of Dock Manor, they had been out at another healthcare facility, and that's where we believe they acquired it. But they came back and their interaction with both staff and residents was pretty minimal. So their scope of contact, if you will, was low. In the case of the employee at Souderton Mennonite Homes, that person had last worked for us on April the 1st. We are interacting with employees and residents around that time, but we are now at April the 10th. And so you can see that time has gone forward. And so even to be out of that 14-day time frame, we're almost there. And we are not seeing any residents or staff with any symptoms because of that. But I think it also illustrates the kind of insidious nature of this disease and how easily things can happen and how the connections around the world and the community can really make this something that spreads pretty easily. And that's also a reason why we need to stay in as tight as lockdown as we can. We also know that it's probably not going to continue to be like this, and there may be some time that we have a situation where we need to open our COVID-19 unit in our nursing homes or things like that. But we feel we're prepared and getting prepared, and we do want to also be transparent about the reality of what is happening as well. So those things are always announced. These early ones are being announced through letters, but we're also putting it on our website as well, and that's primarily how we'll do it in the future because we're not planning to send letters out with every new case.
As I've been on campus a couple of times this week, I've been hearing some amazing stories that remind me that no matter whether we're in the middle of a pandemic or not, life still goes on. Have you been hearing some great stories as well?
Yes, I have been, Alex. And I would say, first of all, I would reflect that staff is doing a wonderful job in a very challenging situation. People are just stepping to the plate and making it happen. Even amidst the fear and anxiety, people are saying, how can I help? How can I help deliver meals? How can I continue to make sure I come in and do my job on a daily basis? And so staff really is performing magnificently. I would also say residents are doing a great job. This is hard. It's really hard to not be in contact with your families. You can via Skype and telephone and that kind of thing. But the reality is that not being able to see a loved one face to face is hard. But from what we know, residents are also doing a very good job with that. And so kudos to all residents as well. This is hard, but we need to continue our vigilance. The other thing I would reflect as part of that is truly, I think we as humans, regardless of your religious background, we are God's hand and feet. We are the way in which we can show love to each other. And so as I reflect on that, we think about and we talk about how God loves us. But I would reflect, and even as in my growing up, I thought, well, the way I see how God loves me is how other people show love to me. So it truly is how we show love to others. We are God's hands and feet. And so an illustration of that is a story, and then I'll tell one from Living Branches as well. But the story goes about a flood, and a person was in a flood, and the floodwaters were rising, and a guy came by in his jacked up pickup truck and driving through the water and said, "Hey, I'll save you. You can come with me." And the person said, No. God, he said his word, he'll save me. I'll wait, no problem. So he drove away, and the floodwaters kept coming up, and the next time a motorboat came by and was trying to give help to this person, and the person said, No, I don't need help. God will save me. Of course, the flood kept rising, and the next scenario was he was on the roof, and a helicopter came by and let down the ladder and said, "Climb up, we'll save you." And he said, "No, God will save me. I'm confident of that." Of course, the story goes that he passed away in the flood, and he came to the pearly gates, and the doors were opened, and his first question for God was, "Why didn't you save me?" And God said, "I tried 3 times, and none of those times did you accept my help." We are God's hands and feet. And so as I reflect and think about that and the ways in which our staff are doing that today, there was a very heartwarming story that came to my attention the other day on one of our campuses, where a couple who lives with us, the gentleman is in healthcare and his spouse, his wife, is in personal care. And it was their 70th anniversary. Can you imagine?
No.
Your 70th anniversary during coronavirus. I'm sure they experienced many other things in their life, but this is hard. You want to be with your spouse. They're already separated. They're in 2 different levels of care. So you can just imagine the sadness that's part of that. But staff became aware of that and were able to have them make a connection. And I saw some pictures of them. The wife was holding up signs, "I love you, I wish I could give you a hug, happy anniversary," through a glass to her husband. And so we maintained the appropriate precautions, but were able to create a time where they could, frankly, share some sacred time together. And so that is just one of many stories of people within the challenges of this crisis trying to make a difference and literally being God's hands and feet during this challenging time.
That's beautiful. And today, of course, is Good Friday. We would be remiss if we didn't mention that. Do you have thoughts about Good Friday that you would like to share with us?
I do, Alex. And I would also come back to Mark Parkinson again, who is the president of the American Healthcare Association. And he was asked about this too, because apparently he had also been previously the governor of Kansas. And as I understand, the Kansas governor, the legislators overruled their decision to request that there not be religious services during this Holy Week. And so he was asked for his reflection on that. I have no idea what his background is, but I thought his reflection was profound. And so I wanted to read that and share that. Mark reflected, that Easter is about sacrifice and life. Sacrifice and life. And he said, we have a chance this Sunday to not just celebrate Easter, we have the chance to live it by all of us making our own sacrifice, creating life. He encouraged everyone to stay at home and do just that, sacrifice and life. And when you think about Easter and what that means in the Christian religion, and for many of us in Living Branches, it's that dark of Good Friday, the sacrifice, and the hope of Easter Sunday. But as I reflected on this as well, Good Friday for the disciples was not like Good Friday for us. For us, Good Friday, we talk about Good Friday and we, in the same breath, talk about the hope of Easter Sunday. Well, that's because we have the benefit of hindsight. It's the genius of hindsight that I say. Everyone can be a genius when you're looking backwards and say, I knew that. I would have done that. But when you're in the situation, you don't know. You do the best you can. And so for the disciples, they didn't know that Christ was going to rise on Easter Sunday. And to remember how deep and dark and bleak Good Friday would have been for them. They didn't have the reality that we do looking back and can say Good Friday and the sacrifice of Good Friday and the hope of Easter in the same breath. So for them, they were experiencing Easter, I would suggest, in a much different way. And I think it's helpful sometimes. I like to kind of put myself in those situations and say, if I had lived then, what would have my experience been? Frankly, it would have been a lot different. We are not experiencing that Good Friday in that same way, but we are experiencing a Good Friday of sorts in that we're in this dark and challenging time. And how do we find hope within that? I spoke about that a bit last week in my video as well. But finding that hope even in the dark of Good Friday. And so when Mark was talking about, in his comments about sacrifice and life, I really think that's the core of what we're going through as well. We're sacrificing now to give life to each other, to give life to others, to flatten the curve, has been said, working at ways that we can provide hope in the midst of challenge. And so we today can speak about the darkness of Good Friday and the hope of Easter in the same breath. And I would suggest that maybe we can also do the same thing in the hope and hopelessness of the coronavirus, that we can say, even amidst this, we can have hope that there will be a better tomorrow. But in the meantime, it is hard. In the meantime, it will require sacrifice, but we will eventually get to the other side. So I really hope that we can remain calm and reflective and find those times, even amidst these challenges, to find the goodness and the hope that's happening even amidst the challenge. So those would be some of my reflections of how Easter, Good Friday, and Easter connect to our own situation today.
To quote Tony Campolo, it's Friday, but Sunday's coming.
That's right. That's right.
Thank you. And thank you for watching this video. We will do this again. So if you have questions you'd like to have answered, you can either email them to coronavirusquestions@livingbranches.org or visit our website at livingbranches.org/coronavirus. And there's a link there that you can use to submit a question. Thank you.